Thank you, Dr. Abhishek. Thank you, Hindi team. Now we are moving to the English session. Today is our 2060th day of continuous webinar. Thank you all the participants and faculties for your support and participation. And as usual, we'll start with a silent prayer. Good evening and welcome once again. Today is our 2060th day of continuous webinar. We are conducting webinar in 3 languages every day without any break and leave for last 5 years. So thank you everyone. Today's our speaker is Dr. SANKET Gupta. He's a homeopathy consultant in New Delhi and 16 years of working experience, and he worked as a visiting professor in JRK with Homeopathic Medical College, and he got many awards like Hanuman Award, Jugal Kishore Award, Economic Times Healthcare Award, and many other awards. I'm not mentioning every awards here. And he presented multiple case presentation in various national and international seminars. Today we got such a talented doctor as a guest, and more than this qualification, he is the son of our A.K. Gupta. Dr. A.K. Gupta is a very familiar person to IFPH, and he is always supporting and loving. He's giving his love to the IFPH forum. Thank you so much for your presence here, sir. You're welcome. Please.
Thank you so much. Thank you, ma'am. Good evening to everyone. And it's a pleasure to be present in front of all of you again.
Your sound also same like Dr. Gupta.
Yeah. Well, genes should speak for themselves, huh? So yes, it's my second webinar here. I did one earlier in Hindi as well, and it's a privilege. And thank you to Dr. Sani that he's been continuing this medical education for such a long time for all of us. It's a marathon effort on behalf of IFPH, and congratulations to all of you. And with this, I would like to start my presentation. I'll be talking about a rare neurological disorder that is called laryngeal dystonia. It is also called spasmodic dysphonia. I'll just share my screen. It's not allowing me to share.
Have you pressed the share button? If it is not possible, rejoin again. Have you pressed the share button?
The share button is not highlighted.
Sir, below the screen, you can see the audio, video, participant list. Can you see all that?
Audio, video, participant list.
Participant, chat, react.
Participant chat, yes.
Yeah, then after react, you can see the share button.
No, I did share. What I'm trying to say, once
it's not visible, huh? Okay,
yes,
okay.
Yes. Okay, yeah, entire screen. I have to click the entire screen. Just hold on. It just got.
Yeah, now it's started.
Yes. Just a second. Are you able to see my presentation?
Yeah, now I can see your screen, but it is, yeah, now started. Role of homeopathy in laryngeal dystonia. Okay, now you can start.
All right. So, as we all know, homeopathy has been, a boon in the last few years, especially post-COVID. I believe homeopathy has always been a boon to the mankind, and thanks to Dr. Samuel Hahnemann that he gave us such a wonderful science and such a fantastic tool to help all the patients all over the world. I mean, before a long time back, you would not be hearing a lot of incurable cases and unheard cases, undiagnosed cases. But in today's times, with the advent of media and with efforts like IFPH, we get to know of so many incurable diseases and so many rare neurological diseases that homeopathy has been able to, cure. And doctors in all parts of the world are doing that. And thanks to Dr. Hahnemann for that. And that's why I always say homeopathy is a boon for the new world order. especially post-COVID. So what is laryngeal dystonia? It is also called as spasmodic dysphonia. It is a voice disorder characterized by involuntary movements or spasms of one or more muscles of the larynx or the voice box during speech. The exact cause is unknown, but there are certain risk factors and there are certain precipitating factors. Usually, the precipitating factors, it says the modern medicine, the textbook says that it is not psychological. Yes, it is not a psychological disorder, but definitely there are precipitating factors and triggering factors that can lead to spasmodic dysphonia. And being a homeopath, we very well know the importance of the mental symptoms and how mental symptoms or mental affections or ailments from mental affections can lead into a disorder or a disease. So yes, exact cause is not known, but definitely mental aspect plays a huge role. So there are three main types of spasmodic dysphonia. One is adductor spasmodic dysphonia, the second one is abductor, and the third is the mixed spasmodic dysphonia or laryngeal dystonia. So by dystonia, you understand, and by spasmodic dysphonia, the name, as the name suggests, spasm while speaking. Dysphonia is, as you understand, difficulty in speaking. So while speaking, when there is a spasm of the laryngeal muscles and the stiffening of the vocal cords, it leads to the disorder where neurological disorder where spasmodic dysphonia occurs. So what is adductor spasmodic dysphonia? As I said, there are two types, adductor and abductor. Adductor is a sudden involuntary movement or spasms that cause the vocal folds to slam together and stiffen. These spasms make it difficult for the vocal folds to vibrate and produce voice. Words are often cut off or are difficult to start because of the muscle spasms. Speech may be choppy but differs from stuttering. So choppy speech would be as if patient is speaking in breaks. I mean, you would feel the tremor. You could feel the spasms in the throat while the patient is speaking. You can very well make it out that this is not a slur speech, but this is definitely a broken speech. And a broken speech due to no, I mean, usually it is a diagnosis of after ruling out everything, you lead to this diagnosis, especially after laryngoscopy and strobotomy, and you reach to this diagnosis that the patient is suffering from spasmodic dysphonia. The voice of an individual with adductor spasmodic dysphonia is commonly described as strained or strangled and full of effort. You would feel the patient has to strain a lot while speaking. And surprisingly, this is very important, and this is a very common aspect of dysphonias and laryngeal dystonia, that usually the spasms are absent while laughing, speaking at high pitch, or even while singing. But singers can experience a loss of range or the inability to produce certain notes of a scale or with projection. When they have to project their voice in a certain level, they might feel that crack. Stress makes the muscle spasms worse. So what is abductor dysphonia? Spasmodic dysphonia. This is a second type. Adductor means add and abductor means away, subtract. So in as the name suggests, adductor, during the adductor spasmodic dysphonia, the vocal cords are stiff, close together. But during the abductor's spasmodic dysphonia, the vocal cords are opened up. They are away. So sudden involuntary muscle movements or spasms cause the vocal folds to open. As the vocal folds open, they cannot vibrate and they are open. The open position of the vocal cords allows air to escape from the lungs during the speech. And as a result, the voice of these individuals often sound weak, quiet, and breathy or whispery. So, very distinctive distinguishing factor between the two symptomatologies of the two types of dystonia is one is whispery and the other is breaky. I mean, voice would break, but still you would feel those tremors. But in abductor spasmodic dysphonia, it would be very whispery. So I'll be presenting in the cases. You will understand the difference between the two, how it comes. And as with adductor spasmodic dystonia, similarly here, at loud pitch, loud sounds, trying to sing or laugh, the voice sounds absolutely normal. Singers can experience a loss of range and inability to produce certain notes of a scale with projection at a higher range. But usually, if they are trying to sing, it sounds fine. It sounds as if they never had a problem. Another is a mixed spasmodic dystonia. This type involves both muscles that open the vocal cords and those that close them, therefore has features of both adductor and abductor spasmodic dystonia. Now, what are the investigations? As I said, it is a diagnosis once you've ruled out everything. ENT usually or a neurologist usually asks you to go for a laryngoscopy or a video stroboscopy. So, as there is no conventional treatment possible, there is no medicinal treatment possible for this disease. But what they offer, the allopathic experts, what they offer Botox injections. These botulinum injections, you've heard enough of that. What they do, they help in anti-aging, they help in skin wrinkling, they help in treatment of certain autoimmune conditions as well, but it is not a permanent treatment. And similarly, in spasmodic dystonia, once you get a Botox injection, uh, one of the patients will talk about it. She used to get Botox injections every 3 months. So every 3 months, and it is an expensive affair. It does sound it. I mean, your voice does become okay for 3 months, 3.5 months, 4 months even, but it is an expensive affair and it is not a permanent solution, and it comes with its own fallacies. So definitely, homeopathy has a better approach to it. Voice therapy, we also ask our patients to try for and go for voice therapy, and communication aids are provided during the conventional mode of treatment. Now, coming to our part, the homeopathic approach. How do we tackle such a case? See, allopathic approach and allopathic modern science, as they say, they will say that there is no cause. But for us, as we all know, interrogation of the mental generals, as I said in the beginning of the session, is extremely important. And in all the three cases that I will be presenting, there was a precipitating factor. There was a certain amount of grief, or certain amount of anxiety, certain amount of stress, and then the patient started noticing such symptoms. So stress management becomes extremely important. Why? Because there are days when these patients are fine, but there are days when these patients are completely down and out. They can't speak a word. Again, on different types of dysphonia, especially in adductor dysphonia, where there is breakage and spasms, continuous tremors you feel. There will be days when the patient is fine, but there will be days when the patient can't utter a word. She or he can't even move out. They can't speak a word. And usually, people who have public speaking jobs, they lose their jobs due to this. And two of my patients are such only. They have been public speakers. One is a psychologist in herself, and still she developed this. So, but the best part is homeopathy could really help them. Of course, constitutional medicine is the dictum. Constitutional medicine is all that we always vouch for. But again, in such cases where all these one of the patients from Delhi, rest all these patients are from out of India. So procuring medicine, especially for the patient in Pakistan, was a challenge. So constitutional medicine you could arrive at, but still you could not, follow the case properly due to certain constraints that I'll talk about while I talk about the case. So organ-specific medicine was also required during these cases. So coming straight to the case, the first case is of Mr. Shishir Kumar. He came to me in August 2013. He's an engineer by profession. He presented with a feeble voice. His was a adductor spasmodic dysphonia. Understand? Strain while speaking, breathlessness, and hair fall. 2 to 3 months ago, when once he came to me, he started noticing that he had to strain while speaking. The voice had started to crack gradually. All of the sudden, there was no, no alarming signs, no warning signs. All of a sudden, he started noticing cracks in his voice, and the situation was so grave that he almost sounded like a female while speaking. The voice was so feeble. When he came to my clinic first, uh, the guy enters the clinic and you see a normal guy, but once he started speaking, I thought, "ये आवाज कहाँ से आ रही है? मतलब, who is this?" It was so feeble. It was almost as if a female is speaking. So he complained that whenever he took hot liquids, the voice would become worse. And by talking out loudly and in morning, it was better. Why? Because due to rest. So vocal rest, whenever you give vocal rest, voice would be a little better, obviously, and it would sound a little better. And as I said, talking loudly is a common symptom of spasmodic dysphonia. So this does not include in our prescription. It is a common symptom of spasmodic dysphonia. He was a thirstless guy, chilly, nervous and anxious personality, brooding at times. During those times, he was going through a job difficulty as well. He was wondering whether I should be in the same job. He was not happy with his job. He should continue with his job or not. And a sudden, I mean, he was not getting married. He was getting aged. He was 29 when he came to me. But because of his voice, his confidence had gone so low that he had stopped seeing girls because he knew I would be rejected in any case. So the biggest anxiety he had was he was not getting married at all, and the fear of rejection, the fear of being looked down upon was really playing on his mind. So he used to brood. He was a good guy. He was a strong guy, but he still used to brood about things. Quite indecisive and confused. This was very important. Uh, Even while making simple decisions of what to buy and what not to buy, was always confused. And usually due to his lack of confidence due to his voice, he had started becoming very regressive, very introvertish, and would not share his emotions easily. So I gave him Pulsatilla, especially. This sounded more like, to many of you, this might sound more like Natramur, but I gave him Pulsatilla because that he was my first patient of spasmodic dysphonia. Let me be very very honest to you. When he came, he was not a diagnosed case, and I was not aware of this trouble back in 2013, that something like spasmodic dysphonia could be the problem. So I thought this was more of an effeminate character and more of a introvert character, very shy and timid guy, and so I gave him Pulsatilla 200. But there was no change. I tried Pulsatilla 1M. Again, there was no change. And by September, he developed coughing while talking. Voice would become worse after eating, he said. So I gave him Causticum 200 this time. But again, there was no change. And he had to strain to speak still. This time I tried Kalikab. Kalikab I tried because he was a chilly guy. He had developed cough. So cough and respiratory, one of the kings of the respiratory remedies is Kalikab. So just a few doses of Kalikab I thought might help his I initially thought this is an ENT and a respiratory problem. This is just simple hoarseness, laryngitis. This might go anytime soon. But it was not going at all. Okay. So again, Kalikab also did not work. By this time, as he started opening up, he told me that he was not finding the right partner. As I said, he had become anxious due to his lack of confidence, and his voice. So he had become really anxious. And due to the anxiety and stuff, I gave him argentum nitricum 1 dose every day. But again, there was no change. So this made me think maybe this is just something to do with hoarseness. Just we have to, focus on the larynx, focus on the vocal cord. So I gave him argentum metallicum TDS 30. There was very slight improvement, but not something to be really happy about. So I still continued with argentum metallicum. But the strain in throat was still there. Voice was very feeble. By 8th February 2014, it was still very feeble. It was almost 1 year, and we were not able to crack the case. We were not able to find out any solution for him, any pertinent solution. So I took the case again, and this time, what I realized was the apprehension of, the anticipatory anxiety was so high, and with that, the the inability to even face somebody due to his inability to speak properly would give him r- loads of anxiety. So I thought this needs to, and his case was becoming worse by the time. Let me be honest, he was not getting any better. In fact, the voice had become very feeble, almost gone to the extent, and still sounding like a female. So this time I gave him Gelsemium 200. I retook the case, gave him Gelsemium 200. Gelsemium 200 was a game changer, just completely changed the game. His voice quality started improving within a month itself. The quality of voice started getting better, and there was no more strain while speaking. So Gelsemium 200 was given again. By May 2014, he was much better. Voice quality almost back to original. Completely, the female voice had gone back to the male voice. No more strain while speaking. And by June 2014, the voice quality was completely regained back to original, and all medicines were stopped. He was completely cured, and he has shared his testimonial. This is back in 2014. We got him diagnosed in between during. I missed that. As during the re-evaluation of the case, we got him diagnosed with a neurologist. I sent him to a neurologist friend of mine, and he diagnosed that we should do a laryngoscopy and a strobotomy. It was diagnosed that he has spasmodic dystonia, and that is when we gave him gelsemium, and he got completely cured. And the best thing is, he got married and he has 2 kids now.
Hello everyone. My name is Shishir Kumar and I am from New Delhi, India. I want to share my experience regarding one of the issue which I have faced a few years back. I was suffering from a throat vocal voice disorder, and it's spasmodic diaphonia. So around 7 or 8 years back, I just faced difficulty in speaking. Uh, like it was very much strained. My voice was coming very low, and a lot of pain was there. And I need to speak with a very much effort, and voice was coming very low, and it was not a continuous. So this issue initially I was totally blank. What is this? So I went through a lot of tests like lung test, then ENT test, and all those like speech therapies, all those things. But means I could not able to figure it out. Everybody has did the test, and I just nothing was coming. I was not able to find what is this. So then I thought, let's try. Why not homeopathics in this? So I just went through. I just went to Dr. Sanket Gupta in OVM's clinic. So there initially he checked and started curing for this issue, and it took some time.
Yeah, now you're unmuted. Okay, okay, doctor.
Okay, can you hear me now?
Yeah, yeah, now I can hear.
Okay, I think something is appeared on this computer only. Earlier, the voice was coming.
Yes, yes. Now voice also coming, and your screen also visible, but not the. Please.
Yes, just.
We heard the voice of the patient. We in the middle, it lost the voice.
I'll just play it again. Just a second. Can you
Hello
hear it
everyone.
now?
My name is Shishir Kumar
Yeah.
and I'm from New Delhi. I was looking on the net that there is no proper cure for this. In the abroad, people are like taking Botox injection or many others kind of thing, which can give a relief or temporary relief, but not the permanent relief. But I don't wanted that kind of things because it is not easy to take injection or any other kind of thing or any other kind of medicines which is temporary and it will be lifelong. So I wanted to cure it permanently through the roots. I want to just cure it, that one issue. So I was knowing that homeopathic is a thing or that can cure from the roots of your disease, which will be cured. It will take some time. I was knowing that, so that's why I trusted on Dr. Sanket Gupta. He was trying the combinations, and after 3-4 months, I just started seeing the results, and then the hope came in me, and I started getting some confidence. And he again just tried and tested and changed his based on my whatever the things was improving. And so after around 6, 7, 8 months or 1 year, then you can say like my voice was 70%, 60 or 70% was improved. So after that, nothing was like that. I thought that I need to finish it, completely. I need to cure it. So after that, I almost after 2 years, it has cured 95%. But I was this issue was so much critical for me, and I was so much worried that I continued for like some longer duration also, so that to properly complete and finish this so that it doesn't come again. So it took little bit like 1 year time, but I trusted on Dr. Sanket Gupta, and I am very thankful to him that this issue has been resolved, and I am now living my normal life. Now you can see how I'm speaking, and my voice is properly fine. But it was very much problematic at that time, and I was not able to speak continuously and losing my voice. And the people who are suffering from this issue, they are knowing that how much problematic this is. And lot of people, because a lot of people are contacting me from abroad, because we got connected. I got connected through many people but during my research. So I recommend them, and I thought to share my experience because so that it can be useful for the any kind of people who are suffering.
Yeah, so this was Shishir. I hope you could all appreciate how well he was speaking without any breaks, and he was not sounding like a female at all. And the best part is that in such cases, you need the confidence of the patient as well. You need the patience of the patient as well, especially when such case comes to you for the first time, and you are also, as he said, Dr. Sanket was trying and testing. So I took a lot of his time. You kept reevaluating the case because he was not getting fine. But I'm thanks to Almighty and thanks to Dr. Hahnemann that he provided us with a wonderful tool of gelcemium, and gelcemium completely cured him. So coming on to the second case, this is of Mr. Shakil Ahmed. He's a public speaker. He's a Maulana based in Karachi, Pakistan. And he contacted me after seeing Shishir's video. So Shishir was my first patient, as I said. So a lot of people have seen Shishir's video only then, and they've contacted me. So he presented with the following complaints: very hoarse voice would crack after just speaking 2 or 3 words. His was an abductor type. Shishir was an adductor type, the first case, and this is an abductor type of spasmodic dysphonia. Strain while speaking at a normal pitch, though would sound clearly whenever he would shout. As I said, it is a common symptom of laryngeal dystonia that once you are shouting or speaking loudly or singing, the sound will be appearing normally. Breathlessness on any attempt to talk. This was very important in this case. Breathlessness on any attempt to talk. Remember this because this is what guided me towards the correct remedy for this condition. He also had chronic sinusitis and was a known case of hypertension and cardiomyopathy. He had been a public speaker since almost about 20-25 years and was always on the mic. For more than a year or so, he started feeling that he had to strain while speaking, and gradually it worsened. And now he would sound as if he is just whispering. He came, this because he was in Pakistan. It was just, I've always treated him over video calls only. So he could not even speak. His daughters would be trying to narrate me the problem. He could not speak a word, and on slightest of effort, air would pass out as if he's literally whispering. So it was very difficult to understand. So he gave me multiple voice notes uh, during those times, uh, just to understand how bad his condition was. And for a public speaker, for he was the only bread earner of the family. He lost his job due to this condition, and it was a very pathetic condition for the entire family. It all began when he had a huge rift with his son, and during the same time, his wife had a heart attack and a stroke as well in 2019. So, as I said, they say there is no cause, there is no known cause of spasmodic dysphonia. But in this case, this was the preceding factor. This was a precipitating factor that led to this complete deterioration in his voice. There would be an aggravation from social gathering and any grief, anything, because he was undergoing a lot of stress during those times. His voice was just getting worse and worse and worse. And better, as you all know, talking out loudly and in morning, vocal rest and lying down, obviously. He had shown to the best of neurologists of Karachi and other areas of Pakistan, but no respite. He was a thirstless patient, usually a calm person and highly principled and God fearing. He's a Maulana, so he was God fearing and highly principled, very disciplined man. He gets anxious of late due to his familial problems and about his family. He has about four daughters, I believe, and just one son, and that son left them in the lurch. He is very strong-willed. He could not tolerate any contradictions. Highly principled person cannot tolerate any contradictions. Doesn't share his emotions easily. He won't really, put his heart out and talk to people, especially his own family. So remember, grief was the precipitating factor, and that is why he was given Ignatia 1M. And also because he's always been a public speaker all his life, he was given Argentum Metallicum as well. With my experience of over, I would say, uh, 13 years now and seeing cases of spasmodic dysphonia, most of these, as I said earlier in the session, most of these patients have been public speaking job or been into, jobs that involve a lot of speaking. So Argentum Metallicum has always been in picture because it has that organ specific area in the on the larynx and on the voice box. So Argentum Metallicum was given just to start off because he's been a public speaker. But Ignatia 1M was the main prescription. He was slightly better with Ignatia. He started speaking a little longer sentences, and Ignatia 1M was continued. But Argentum at 30 was also continued. This was back in November 21. But by the time, you have to remember that he is not coming to me. He is only following me up online, and that too when he is not in a financial constraint. He had a lot of financial constraints. He would not even be able to afford my consultation fees. He would always keep asking for discounts, always keep asking for discounts, always keep, sir, please reduce the consultation fees, please reduce the consultation fees. So and by January he was unable to speak continuously, and breathing would suddenly stop. and voice had, he gave me a symptom that voice becomes better by lying down. It is usually a symptom in spasmodic dysphonia, but seeing his, tendency towards money and loss of business was the, loss of job was the, again, thing on his mind. So I gave him Brinia, but that didn't really help much. But Argentum metallicum was continued. There were very slight improvements, but nothing major. So I tried to jump to Argentum metallicum 200 this time, once a day, every day. But due to, again, financial constraints, they used to call me once in 2 months or 3 months, and by May 23 they had completely stopped. I mean, May 23 they came again. They had completely stopped the consultation for about 8 or 9 months and did not take any medicines. But he, on his own, he was taking Argentum metallicum during that time. He did not take any of my consultation. But seeing that Argentum metallicum, he was continuing, but there was no respite. He was still not getting better. So this time I got back to the case again, and as I said in the beginning of the case, breathlessness on slightest effort to speak, straining on slightest effort to speak, weakness on slightest effort to speak. The standout medicine for that is Stannum metallicum. And Stannum metallicum 30 was given, TDS, this time, and he started improving very nicely, very, very nicely. By October 2023, the breathlessness became much, much better. He was able to speak continuously without any breaks in the voice. Stannum at 30 was continued. Also, we have to remember, as I said in the during the beginning of the case, he also had chronic sinusitis. He also had hypertension. He also had cardiomyopathy. So his cardiomyopathy and hypertension were also being taken care of simultaneously with homeopathic medicines only. He was completely, by the time he had started showing results and started showing improvement, the faith in homeopathy became much stronger, and he started pushing me for giving medicines for his cardiomyopathy as well and hypertension. And thankfully, even that those were taken care of. And by January 2024, all symptoms completely improved, 90% improved, and still Stannum at 30 was continued. By May 24, voice quality was back to original. He doesn't even need a mic to speak now. That's the best part. He doesn't even need a mic to speak now. He can speak on his own, very loud, fantastically, completely with confidence. No more strain while speaking, no hoarseness, no breathlessness. BP also under control with homeopathy, and cardiomyopathy well under check. We got his echocardiography also done during those times, and it was fine. I mean, everything was fine. So no more medication was required, and the patient was completely cured. And look at how he has to say. Sorry, you can appreciate his voice here.
कराची के रहायशी हैं तकरीबन 2020 में मेरी तबीयत खराब होना शुरू हुई थी, तो मेरी आवाज बिल्कुल बैठ रही थी। फिर वो आई थिंक 2021 में आवाज मेरी बिल्कुल बैठ बंद हुई और आवाज निकल ही नहीं पा रही थी। कोई एक वर्ड बोल लिया तो दूसरा वर्ड मैं नहीं बोल सकता था, कंटिन्यूटी नहीं थी मेरी बात में। तो बेसिकली मेरी फील्ड भी स्पीकर की फील्ड है, स्पीचेस होती है मेरी, तो बिल्कुल ही अब मामला खत्म हो गया और एक वर्ड के बाद दूसरा वर्ड मेरे मुंह से भी निकलता था और आवाज मेरी किसी की समझ में भी बिल्कुल नहीं आती थी। बात में कर ही नहीं पाता था। तो फिर यहाँ काफी हमने ट्रीटमेंट की पाकिस्तान, लेकिन कोई समझ ही नहीं पा रहा था कि मामला क्या है। तो कैमरा वगैरह डाल के भी देखा नेशनल हॉस्पिटल में, तो वहां उन्होंने ऑलरेडी एक चीज डायग्नोस की थी कि ये सिंपल डिस्फोनिया है। तो फिर वो नेट पर मेरी बेटी ने इसको सर्च किया तो ये डॉक्टर संकेत गुप्ता का पता चला था वहां से कि इन्होंने किसी की ट्रीटमेंट की थी स्पेसिफिक डिस्फोनिया की। तो वो फिर हमने इनसे ऑनलाइन रब्ता किया तो इन्होंने पूरी बात तवज्जो से देखी और फिर ट्रीटमेंट शुरू करी। और तकरीबन तो भी मैं बात कर रहा हूँ, लेकिन 1 साल पहले ही से अल्हम्दुलिल्लाह मेरी आवाज बेहतर हो गई, मेरी स्पीचेस वगैरह भी शुरू हो गई थी। तो लेकिन माइक यूज करना पड़ता था, लेकिन तो काफी हद तक इम्प्रूवमेंट इतनी आ गई है कि माइक भी यूज नहीं करना पड़ता। तो हमारा डॉक्टर वेरी नाइस डॉक्टर संकेत गुप्ता, और मेरे अपने पॉइंट ऑफ व्यू से जो कि अल्लाह ताला ने मुझे शिफा दी, तो मेरे नजदीक तो ये सिर्फ इंडिया में नहीं बल्कि मैं तो पूरी दुनिया के हवाले से कहूँगा कि इज द बेस्ट डॉक्टर। और होम्योपैथी के अंदर बहुत एक्सपीरियंस है इनका कि होम्योपैथी ट्रीटमेंट बेस्ट ट्रीटमेंट है। सबसे बड़ी चीज तो ये है कि इससे कोई साइड इफेक्ट नहीं आता। इन्होंने मेरे हार्ट के हवाले से, ब्लड प्रेशर के हवाले से भी मेरी ट्रीटमेंट करी, तो बीपी भी मेरा रात में शूट करता था। तो इन्होंने 12 दवाएं तजवीज की हार्ट के हवाले से भी और बीपी के हवाले से भी, तो वो भी तकरीबन 2-2.5 साल हो गए ना मुझे बीपी की शिकायत हुई और ना मुझे कोई हार्ट की प्रॉब्लम अल्लाह की तरफ से ऐसी कुछ भी नहीं। और सांस का मामला था मेरा ज़ाहिर वो स्पेसिफिक डिस्फोनिया में भी, और आई थिंक शायद कुछ हार्ट में भी, इसकी वजह से सांस मेरी बहुत फूलती थी। मैं बोल ही नहीं सकता था कि वो अल्फाज मेरी सांस मेरी साथ ही देती थी। कोई मैं अगर कोई मैं अपनी आयत पढ़ना चाहूँ तो मैं नहीं पढ़ सकता था, लेकिन अब तो बहुत 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 बेहतर। मैं अगर कहूँ कि 92 अबाव, चूंकि वो मेरी हॉर्सनेस भी खत्म हो गई और जो आवाज मेरी बिल्कुल ठस रही थी तो वो भी खत्म हो गई, कंटिन्यूटी से मैं बोल रहा हूँ। तो ये गुड गिफ्टेड डॉक्टर रही हमारे, और मेरे तो ये हमारे तो ये फैमिली डॉक्टर है, तो मैं इनको बड़ा अप्रिशिएट भी करता हूँ और बहुत इनका मैं शुक्रगुजार भी हूँ। और इनके लिए बड़ी मेरी, आप इनकी लैंग्वेज में कहें तो मेरी बड़ी प्रार्थना है इनके लिए कि ये इसी तरह लोगों की खिदमत करें और लोगों के लिए दवाएं तजवीज करें। और इनको हमारे लिए तो अल्लाह पाक हम कहते हैं अपने, तो ये भगवान कहते हैं। रास्ता तो एक ही जा रहा है, भगवान का भी अल्लाह के रास्ते ही है। तो इनको इसका में, और ये सबसे पैसे पर दौलत पर इनका दिल में खिदमत का जज्बा होता है, उसके मामला को बहुत ज्यादा मेरे नजदीक बहुत ज्यादा इसमें कामयाबी मिलती है। और ये इज ए वेरी सक्सेसफुल डॉक्टर और ग्रेट डॉक्टर। तो ये मेरी एक बातें दी, अब आपने मेरी बात खुद भी सुन ली। मैं अल्हम्दुलिल्लाह बड़े आराम से बातचीत कर रहा हूँ और इसके लिए मैं हमेशा अपने डॉक्टर के लिए शुक्रगुजार भी रहूंगा और दुआ को भी रहूंगा। और यही मेरी अल्फाज थे कि अल्लाह ताला कबूल करे। अस्सलाम वालेकुम।
Thank you. So another wonderful case that I hope you all could appreciate. He was not able to sound even 1 or 2 words, and he has spoken for 5 minutes just to give this testimonial to all of us, for all of us to appreciate what all homeopathy can do. Now another case, just the last case for the evening. Another cured case. She is a psychologist herself. She is from California, USA. So she, again, an online case, video consultation. So she, being a psychologist, it had become extremely difficult for her to, see patients, see her clients, because she had started developing this tremors in her voice. You could sense that her voice is always shaking, always shaking. She might be shaking inside. You could sense like that. You could feel she's always shaking. But again, gelsemium was the medicine that cured her completely. Gelsemium, again, because we are aware it has an action on muscular in coordination, and because again anticipatory anxiety was supremely high in this female as well, especially when she was going to meet any of her clients or any of her meetings or any of her presentations. And look at her, how beautifully now she speaks. And how she speaks, she used to take botox injections regularly just to speak, just to make her life back to normal, and be able to see her clients. But for a psychologist, you can imagine, she is taking a lot of toll from patients herself, from clients herself, and on top of that, having a problem of her own, not being able to, comprehend, not just comprehend, not being able to, put out all what she wants to say and on help her patients. So this was really impacting her, and I'm really glad, and I'm sure she's also thankful to homeopathy that it came to her aid. Just have a listen to her.
Hi, my name is Elsa. I was diagnosed with spasmodic dysphonia in 2011. It was very, very difficult at the beginning. Some days I could barely produce any kind of sound. My voice had a strangled quality to it. It really impacted my self-confidence. Sometimes I would have a clear voice, and then other times it would sound like a jumpy record player. That's because of the tremors that were happening inside of my throat. Oh, I want to preface, I always had a mild case of spasmodic dysphonia. There would be times that I could speak normally, and there were other times where I couldn't really speak well. The physicians here in the United States thought that possibly I had a combination of spasmodic dysphonia and muscle tension dysphonia. So in times of stress, or if I was really nervous, that would somehow affect the spasmodic dysphonia. So they kind of work together, not in a positive way. So here in the United States, the recommended course of action is Botox. And I did, in fact, try Botox. I did that successfully for a few years. And in 2018, I ended up leaving the job that I had just because the talking was very difficult and I knew I needed to do something different. And I stopped doing Botox as a result because I no longer had health insurance. So fast forward, I'm part of a global Facebook group of other people with spasmodic dysphonia. And that's how I met Dr. Gupta. I started working with Dr. Gupta in March of 2021. Again, my symptoms were mild, but he could still hear them. They were still affecting my ability to talk with people, my ability to be social. I never wanted to go out. Restaurants were always so challenging for me. And what has happened after 2 years of working with Dr. Gupta is my tremors have almost completely disappeared, which I'm so grateful for, Dr. Gupta. And I'm able to go into restaurants with friends. I'm able to be social, which is such a blessing. And now Dr. Gupta is helping me with my ability to project. We first wanted to handle the tremors that were happening. So I still get a little bit caught in my throat, but if someone didn't know I had SD, they wouldn't know. So I'm so grateful. Thank you, Dr. Gupta, for supporting me these last 2 years. You are a blessing. Thank you.
Thank you. So this was Elsa from USA, from California. You can appreciate what she was saying, that she has been having this trouble for over almost she had been having that trouble for over 10, 12 years. She started developing this in 2011, and being a psychologist, she lost her job in 2018. She could not afford the Botox injections. As I said, it is not the permanent treatment. And even after all of that, it was homeopathy that came to her aid. It was completely the natural science of homeopathy, the beautiful tool of gelsemium that cured her. What she's talking about right now is the projection. So by projection, what she means is when she has to speak loudly, for example, she has to shout to call a friend. She's again a very timid and shy girl by nature, woman by nature. She can't really, she doesn't really like shouting too much. But if she has to shout, so she is not able to really project her voice. This was at that time. But again, in projection, Stannum metallicum helped her, and now she's completely off all her medications. She's completely cured, and she's referred me 2 or 3 more of her friends who've had spasmodic dystonia, because she's a health worker herself. So she is spreading the word across that homeopathy can help treating spasmodic dystonia. And this was my presentation. Thank you very much to all of you for patient hearing. I hope you enjoyed the presentation and appreciate how homeopathy can be really wonderful to all the humankind, and especially in such cases. Thank you so much.
Thank you, Doctor, for your wonderful presentation. And
Any questions I would like to answer? Anybody has any questions? I think we still have 2 minutes, 3 minutes.
yeah, we have 6 minutes.
We have 6 minutes. Okay, wow.
If anyone have questions, you can ask. Oh, sorry. Okay. Okay. If anyone have question, please ask. Otherwise, Dr. Ramparvesha, sir, you can speak.
Thank you, Dr. Anjani. And congratulations, Dr. Sanket Gupta.
Thank you, sir.
Very nice for an excellent session. Evidence-based presentation of IFPH on the role of homeopathy in laryngeal and spasmodic dystonia, including well-documented treatment of 3 patients, fishing in continuous success in advancing clinical homeopathy, not of medicine, spasmodic dystonia, argentum naticum, argentum metallicum, asternum metallicum, gelsemium, including arnica. Arnica is a very good remedy, and causticum. Always use first arnica, after causticum and gelsemium. According to symptom,
Yes.
angle of treatment,
Yes.
mental and physical.
Yes.
Working. So according to symptom, select remedy. Very thanks, Dr. Sanket Gupta, Papa Dr. A.K. Gupta, Secretary General HMI. So very thanks. Ghar homeopathic, ghar homeopathic.
There is a question in the chat box. Is there any medicine to prevent the reoccurrence?
Okay, so as we all know, there is, because every case is an individualized case. I won't really say there is a one single remedy to prevent reoccurrence. What I found in most of the cases, I've cured. I mean, I've treated almost more than 25 or 30 such cases. most common remedy that came out to be in such cases was gelsemium. Why again? Because stress and anxiety has always been an associated factor. Okay, so once you see that there is an anticipatory anxiety and there is an sense of that anticipation, and because it has our gelsemium acts on the muscular and coordination, so gelsemium acts very nicely. And once you've cured, you don't really need anything to prevent the reoccurrence. You just need to counsel the patient that this can get triggered under certain stages like acute stress, certain stages like any immunity impacting illness, or any immunity compromised condition, and accordingly we again treat that. But can't really say that one week I can pinpoint on a medicine that can be used as a preventive. But I hope, yes, gelsemium can be used. You can try that. You can try that in 30 potency. You can try that. Won't really document on that because I've not really used it as a preventive. All such cases have been cured, and we get fantastic results from other medicines also. As sir said, arnica is also one. In one case, I used arnica as well because that was arnica due to mental trauma, not physical trauma. It was used in a case of mental trauma. So yes, again, mental aspect in such cases is extremely important, and case taking becomes extremely important. Thank you.
Astimonium is the
Thank you,
spasmodic
and you said for both cases you used gelsemium, and the other case cured with stanamet, right?
Stannum metallicum, yes.
Why you gave stanamet?
Stannum metallicum was because he would become extremely weak while trying to speak.
Yes.
Extremely weak, because see, abductor dysphonia is the voice cords are away. The vocal cords are away, so any effort would sound like whispering.
Okay.
Right. So lungs were impacted. It was not just, in a sense, you would feel that lungs are also impacted once you see the patient physically. Okay. So Stannum Met is a wonderful remedy when it comes to weakness from any effort to speak. 3-mark medicine for that.
Thank you so much, sir. Now it is time for the another session.
Thank you so much.
Wonderfully presented the cases with evidence. Thank you so much, and come again with another such wonderful cases. We are eagerly waiting for your next session. Thank you so much, and thanks to AK Gupta sir also. Now we are moving to Malayalam session. I am inviting good night to everyone. Thank you all the participants. And now I am inviting Dr. Mariamma John for moderating Malayalam session. Dr. Mariamma John, you are welcome, please.